Thank you.
Thank you, ma'am.
मी सांगते मग सुरू करायला तिला ना. Yes, Pradnya, we are live now.
Good morning, everyone. Are you all excited for today's session? Well, I am. First of all, let me thank you all for taking your precious time out for this session. World Autism Awareness Day is an internationally recognized day observed every year on 2nd of April. Taking this opportunity, I would like to introduce myself. I am Pradnya Nalke, working as a middle school counselor in Symbiosis International School. I extend a very warm welcome to all those who have joined us for the panel discussion today. We will be focusing on sharing stories and providing opportunities to increase understanding and acceptance of people with autism. Today's session will help you all to provide these children reach their full potential. The session is brought to you by Symbiosis Center for Emotional Wellbeing, that is CUE. We're extremely honored, privileged, and fortunate to have experts in this field with us today. We have Dr. Ashwini Kulkarni and Dr. Mitali Vaidya as our panelists who will shed some light, give us some knowledge and information on autism spectrum disorder, thus clearing our myths and doubts on autism in case if we have any. Dr. Ashwini is a consultant developmental and behavioral pediatrician. She is associated with Small Steps at Dinanath Mangeshkar Hospital and Subhanand Clinic. Her main interest area has been identifying and treating early childhood developmental disorders. Thank you, ma'am, for taking time out from your busy schedule, and we're absolutely delighted to have you with us today. It is indeed a pleasure. And our second panelist is Dr. Mitali Vaidya. She is a consultant diabetologist and certified relationship development intervention consultant. She is the secretary of Rajhans Foundation. Rajhans Foundation is a center for children having autism. The center is run by the parents of children having autism spectrum disorder. She is working in this center from the past 6 years. So we can see she has worked with these children of varied age groups who have been dealing with autism. Thank you so much, ma'am, for being here today. I'm sure many of us are going to benefit from your experiences you share. Your vast knowledge and experience in this field will definitely help all our viewers gain good insight on this subject. So today, through this panel discussion, we will try to understand what autism is, the different types and symptoms, interventions need to identify in the early years, possible ways to integrate autistic individuals in our society, and much more. So, without further ado, let's begin this session. Good morning, Dr. Ashwini.
Good morning. Yeah.
So, I would like to ask you that what is autism and why is it referred to as autism spectrum disorder? Can you tell us about the spectrum and the symptoms?
First of all, good morning to everyone and many thanks for those wonderful words. It's my privilege and honor to get this platform to share my views with you. Many thanks to Symbiosis Center for Emotional Wellbeing and everyone associated with it. So moving ahead, we are going to see, I'm sharing my screen. What is autism spectrum disorder? So the first thing what we need to see is that, just 1 second. Yes. So first, autism is the word which was first was coined by Bleuler, who was a psychiatrist in 1908. It was related with the persons when he observed regarding schizophrenia. It means that autos means self, the child or the person who is engrossed in self. Since that time, our understanding about autism spectrum disorder, the clinical features, the symptomatology, the treatment, and the research has been gone through different stages. Currently, what I will be talking about the current understanding of autism spectrum disorder now. Now we know that it's a neurodevelopmental disorder. It means what? It is related with the developmental neurology, developmental brain. And usually the symptoms are seen within the first 2 to 3 years of life. So we call it in a neurodevelopmental disorder group. Now here we see that usually the clinical features or the symptoms are related with the deficits in social communication, language, and behavior. So it's purely a kind of a neurobehavioral syndrome where we see the changes in the child's speech, child's behavior, and child's mixing with the people. Now, why we are calling as a disorder is that it is a developmental condition of the brain. Condition means what? Here, there are the different parts of the brain which are related with the social communication network, with the language, with the involvement, with the reciprocity. And yet the connection or the in between these different parts of the brain is typically developing in a different fashion, in a different manner, where the child likes to be in his own world and immediately doesn't reciprocate with you with the other gestures. So that's why it is called as a disorder, not a disease. And that's why we use a word control, not a cure. So this is first important thing when we need to understand that it's a kind of a condition where we are trying for our child best to develop the integration between these different parts of the brain. So all the kind of our therapies, the treatment, the medications aim at this point where we need to integrate all these things. Now, the most important thing which we need to understand that these deficits in the communication or the language or the behavior must affect the functionality of the child, must affect the functionality of that individual, participation in a group, in school, in the workplace, and the other areas of life. And why we call this as a spectrum? A spectrum is a kind of a umbrella term. That means that we have a lot of variation between the types and the severity of the features. In some children, we may diagnose it quite earlier by the age of 1 year. In some children, we may diagnose it by 5 years, 6 years, even though we may suspect it in adults. Some children may be diagnosed in a later year of life. So there is a wide spectrum between the presentation and severity. Some children, most of our minds now, many of us, we know that these children, they commonly present with a speech delay. So we think that these children cannot speak, but it is not like that. In this also, we get a lot of spectrum. Certain children are verbal. Some children can communicate. They can they can involve in you. Some children are, even their languages are so good that they can write something. So again, it's a kind of a lot of variation in this clinical features. That's why we call this as a spectrum. Again, regarding the mental abilities of these children, again, there is a wide variation. The typical terminology which we see or which we understand is that no two children of autism spectrum disorder are like each other. That is most important thing that us parents or everyone as a society we should know. So many times it happens that the parents read about something or they go through something on internet or through paper and through books, and they find out that yes, so is it the same thing with my child? So there is a spectrum. We should understand that the features can be mild, can be moderate, can be severe. So no two children are similar. There are unique strengths in each child. And our aim is that we need to explore those unique potentials in that child, and we think it as a skill-based game. So I request everyone to take it as a skill-based approach where we need to develop the deficits or the skills which we want to develop in the child, and we work together to imbibe that skills. If we take it that way, it becomes very easy and we don't get burdened with the word disorder. So that is my request to everyone. Now we should understand that it occurs in all genders. The male to female ratio is 4:1. There are different reasons for that. It is seen in all ethnic, socioeconomic, and racial groups. So this is what about the word autism spectrum disorder. And a wonderful question was asked that why we call it as a disorder. And here the term, again, I will understand that it's a kind of a condition. It's not kind of a disease. So we use the word control, where we are trying to decrease the severity of the difficult behaviors and improve the acceptance behavior or the meaningful, engaging behavior of the child. And we have seen in these years that it increases. So I need to end it with a positive note that all these things, they get improved as we work along throughout the years. So now we are going to see about the second point, which was asked, what are the symptoms, clinical features? So here what we need to understand that currently we are diagnosing an autism spectrum disorder or suspecting autism spectrum disorder with DSM-5 criteria. And the one thing which we need to understand that it is purely a behavioral diagnosis. That is the most important thing. That many a times we think that if it is a kind of a disorder, are we going to do some, can it be diagnosed with MRI? These are the parents' questions. Do we require an MRI for the diagnosis? No, we don't require an MRI. We don't require lab tests to diagnose. This is all the behavioral observations, and the difference do occur with parental observations, with observations by the expert who has been trained in this field. So many a times it happens that there becomes some different observations between the parents and between the specialist who is working in this area. We need to understand there that I'm taking 2 minutes to discuss the slides. There are two important aspects. The one is the social impairment in the communication. Means what? What are the steps or what are the important stages of social communication? They started from the first year of life, where we can actually suspect and we can pick them early. By 4 or 6 months, the child definitely gives as an eye contact. When we say ah, the child says ooh, agu. So this is the child wants to involve in you. The child wants to reciprocate. The child wants to mix with you. He is telling you through his gestures that yes, I'm interested in you as a mother, in you as a my caretaker. So these kind of communications, these kind of small reciprocity gestures, because gesture is the first thing which appears, it is usually found not developed in these children. So there are typically 3 patterns. In one pattern, the child develops all the reciprocity or the communicating features by 18 to 24 months, and the child stops doing those things. The child stops using mama, baba, dada, maybe one meaningful word also. But by that age, the child stops after that. It is very painful for parents. The second thing is that there is developmental delay. The delay is in all aspects. There is delay maybe in walking, maybe in hand functions, maybe in understanding, that too in language. And in the third part, the deficit or the delay is typically in language and the communication perspective. Now, what are the other features of communication? Eye contact. When we are when we are feeding the child gives her eye contact. Child looks towards you. Child, whenever we are showing something, look, see, that is a fan, or see, that is a bird. There is a chew. The child immediately looks to your finger. See, that is there. You look at the same object. The child is looking at the same object. This is what we feel that the joint attention, that is you, me, and the child are looking at the same thing, is found to be lacking as in children with autism spectrum disorder, where we can diagnose them as early. So these are the small features, or there is a wide variation in the symptoms or the presentation for social communication deficits. As per age, the social communication understanding, its presentation changes. In some older children, the child may say hi. Like, for example, a verbal child with autism, by end of 4 or 5 years, the child may say hi. He may greet you. But if you ask him, what have you done in the morning? What did you eat in the breakfast? Or if you child engage with him in a meaningful communication, the child may not reciprocate. He may stop at that point. It may present like this in older children. So again, there is a wide variation in the part A. social communication, interaction, and network. And the second most important thing is that restrictions or repetitions in the mannerisms or the behaviors. Now, for this, I am going to second slide. Now, I hope that this slide is visible. It's a very wonderful slide. And I'm very glad to take this slide from one of my colleague, Susan. She has been working with the Christian Medical College, Bangalore. And this was under her teaching module where they have developed these kind of lecture, like a set of slides. So this is where we can see that these are the restrictions. They can be motor. The child keep on looking his hands. The child keeps on flapping. The child keeps on rotating, spinning. The child keeps on giving a visual eye contact. Whenever whatever you give, the child looks through the angles. The child likes the movement activities, look towards the fan, likes towards the switching on of the fans. There is inflexibility or adherence to routine, that the child does one play repeatedly. You may not find it meaningful. This is very important to understand in the first 3 years of life. Child explores everything. Child wants to touch everything, whatever the surrounding, whatever the things are in near him, whatever you are handling. But you may find that the child is not doing the meaningful play with that activity. If you give him something, small thing, he keep on moving that object, or he may be doing the same thing repeatedly. So repetition, non-meaningful play, or adherence to the same thing is very important, which can be found out as early as by 2 to 3 years. Now, there are very fixed interests. For example, I tell you, this again depends upon changes as per age. For example, in few children, if a child with they can say, no, he likes cars only. If we give him something other toy, he may not be play with that car. Now we need to ask them how he plays with the car. So the word play is very important. As a parent, as caretaker, we should understand how the child plays with that object. And the parents will tell us, no, he keep on just moving backward, forward. He just keeping on looking at the wheels. He may be doing only crushing things. But if you ask them, is he playing with them like you see that he will ask you, कोणीतरी आलं त्या गाडीत बसलं, मी ती गाडी घेऊन गेलो, मी त्या गाडीमध्ये पेट्रोल भरलं. Kind of this exploratory play can your child do by 3 years? The parents will say, no, we don't know. The child should play like that. So this is what we should know, that most of the times parents don't know how the child should play with the things. And the child is fixed with that interest. If you ask for an older child, the child may say, nahi, त्याला फक्त dinosaurs आवडतात. If you see, his figures are like dinosaurs. If you see, all toys are like dinosaurs. Whenever he goes to other home, he will pick up any toy who is looking like dinosaur. So this time the parents typically get confused because there is a wide spectrum and with what we call as a scatter, that the child does some things the parents are very proud of. The child is having so many things. The child knows alphabet. The child knows so many songs. But this is by 4 and 5 years, the parents are just amused. He knows all the numbers. Even some children can know the tables. This is a very good thing. But at the same time, the parents are cared about why my child is not saying hi to the other child. Why my child is not going and playing with the other child. So there is typically this scatter. And that's why the parents get confused and they take time to come to us. And the third most important thing is hyper or hyposensitivity to the sensory stimuli. It is wide, actually, if I want to speak regarding these sensory issues, I will take next 30 minutes. So we should understand that the child understands all the things through how he sees, how he feels, okay, how he smells. So there are some children, they have different reactions to these sensory stimuli. They don't like some kind of textures. There are very peculiar eating patterns. They have sleep difficulties. So they doesn't like some kind of changes in the clothes. They want to wear some typical kind of clothes. So these are the wide changes in these clinical features. These are common clinical features which we see. The child doesn't give an eye contact, or he shuts off. He gives, but then shuts off. He doesn't give you throughout the activity. The child doesn't like hugging, cuddling. There's a lot of stranger anxiety. Whenever you go, the child starts howling, screaming. The child doesn't have an interactive play. So all these are motor mannerisms I have talked about. So this is kind of a very wide spectrum. And the most important thing, as we are dealing with the clinical features or the early identification or awareness between all our general public about our society, as we know that we should diagnose or we should suspect them early. These are some of the very important things that we need to see within the first year of life, what we see in the second year, and what we need to 3 years, because our aim is to pick them early, maximum by 2 to 3 years. So before, if we pick them up, if we work with them, we have a very good abilities this child can develop. So these are the things: poor response to name recall. The child doesn't like peekaboo. The child has, we have seen that speech, language, and more delay. More important is imitation. It starts from 9-10 months. We start them, chala taya wajwa, vitthal vitthal kara, ithe ithe basre mora kara. The child is not interested in you. And where I think if parents feel that the child is not getting involved in you, the child is not being able to understand what you're doing, not able to give you eye contact, not able to imitate, anukaran karat nahi hai tumhala baal, so please connect with your pediatrician. Ask them that I do have questions for this, and ask for a detailed developmental evaluation or referral to a specialist. So going again back to Pradnya, we can go ahead. I think I'm much clear about the spectrum, the symptoms, the wide variation range, and I have not talked about the comorbidities yet, that we can speak later on. Many thank you.
Thank you so much, ma'am. You have shared a plethora of knowledge with us today. So what I understand from what you have said is that early identification is very important, and it can be diagnosed or identified at as early as the age of 1 year, isn't it?
Yeah,
Yes.
yeah.
And it will be more helpful if the parents know what are the developmental stages as the
Yes.
child's growth, so that they can identify the child better. So one takeaway is that there should be no eye contact if the child has got symptoms of autism. There will be no imitation or less imitation, and less of interaction or no interaction at all. Right, ma'am?
Yeah, right.
Okay. All right. So moving ahead, Dr. Mitali, welcome. So how has your experience been about raising a child with autism? How did you diagnose, and do these symptoms change with time and age?
Thank you, Pradnya. And at the outset, let me thank Symbiosis and all of you for giving me this opportunity to share my views. So, more than anything now, I am a proud mom of a son with autism who's 15 years old. And that has been my main the reason, and all that I know about it is because of him. So yes, the diagnosis was just like Dr. Ashwini ma'am said. So at the age of around 2, we realized that whatever language he had developed, that he was using much less and less. And we noticed he wouldn't respond when we called out to his name, and he was very hyperactive, always on the go, constantly running, and it was getting difficult. And these symptoms, I mean, up to 1.5 year, we did not feel there was anything wrong, and there was good interaction, good eye contact, everything. But somewhere we didn't notice when this started happening. And after that, around by the time he was 2, we could see that when we compared it to the other children, we could realize that the understanding was also quite less. The perception of the surroundings and all was definitely lesser. So when on the next visit to the pediatrician, we just mentioned our doubts, and then he definitely observed and confirmed that yes, there is some cause of concern, and we finally got a diagnosis from developmental pediatrician Dr. Vibha Krishnamurthy in Mumbai. So that was the time that we knew that okay, it is there in our lives now. So whenever a child is diagnosed with autism, it is always a life-changing moment, because it is like up till now everything was okay, everything was usual. You had some doubts, but somewhere in your mind, you're thinking, nahi, nahi, kuch nahi hoga. Maybe things will sort out. So it won't be. It's just our fears. But then when you finally receive the diagnosis, then there is no going back. So yes, it is a life changing moment, but it is, as I said, it's a changing, it's just a turning point, and where you take it from there is all up to you. So it is like it is your child, and you're the only one who are going to be there for him all throughout. Who will believe, once you believe in your child, he or she will believe in themselves, and the society and everybody else will. So that's important. So once, of course, once we are diagnosed, it is important to have a reach to, access to good resources, as in what good therapies are there, good therapists to help you out, and more than anything, a firm family support. It is the most important thing, because there are different challenges that come across. The lot of doubts that the parents have, and it's important that the family supports wholeheartedly. And it's not just autism doesn't become the only focus in your life, it's just a part of your life of your child. So the childhood is still there, your family is still there, so it's important to focus on all fronts. So of course, after the diagnosis, like every um, all parents, we also got into all therapies. Like we started with ABA. There's this mother child mother child training program at Umeed for all those who are newly diagnosed, and that was very good, because you're in a territory where you don't know anything what to do. This is, you don't know, just don't know. Even if we were both doctors, we didn't actually know what to do. So that was important, that we that program really helped us to at least gain some foothold in how we can reach our child. So when we saw him learning things through ABA and speech therapy, there was some solace. Okay, there's some way that he is learning. So that was there, but after some time, I thought there was something missing. These were all instructional drills and static skills that we were teaching, but somewhere for me it was like there was this connection which was missing. There was always answers and instructions and right answers to questions. So it was just that. So there was something more that we need, between an interaction between a child and a parent. So that is when we came across RDI, which is Relationship Developmental Intervention. So we consulted an RDI consultant and we started the program. Now this is a program where it is parent based. So the parent is trained how to guide the child. So it is like, generally, when, because of autism, we as parents are not naturally wired to instinctively raise up a child with autism, because their brain probably works a little different from yours. So to be able to understand the similarities and the differences, that kind of thing, RDA really helped us to tune in with our, getting back to our natural parental instincts, it in raising our child with autism. So there is a lot about, in short, it is about slowing down, and rather than continuously instructing, letting them have a situation where they have the right amount of support and challenge, however small they need, however small the challenge may be. But it is where they start developing the fact that I am the one who is thinking through this. So even if it is as little as taking a step ahead, or reaching out to take an object, as simple as that, it is their own motivation which does that. So this kind of this guidance helped us to start a new way of parenting, along with, of course, the static skills are necessary, whatever the children learn as special education as well as occupational therapy. So all of that was continued, and we started noticing the changes. We started we could see him developing as an active thinker. So that was a real good part, where we start, once you start some therapy, you start getting hope that okay, this is going to lead somewhere. So as far as the as you asked, are the symptoms changing with age and time? Yes, when you start your therapies, definitely you see the differences. You see your child learning, making progress, and of course, at every point you have to see whether whatever you're doing, because there is a huge variety of treatments are available now with the internet. There is nothing. I mean, there are lots and lots of new things coming up, but it is important as a parent, when you're trying something, you see whether your child is comfortable doing it. It is good for him? Is it beneficial for him? Is he comfortable doing it? And how and whether whatever efforts and time you're putting it in, is it making any effect on it? Once that is there, it is definitely whatever your if you put in diligent efforts, definitely things improve. Another thing, but yes, it's like a roller coaster ride. Sometimes you'll have these tiny victories which will be like huge things for you. Sometimes then they will surprise you beyond your expectations, and but sometimes there will be challenges which arise which you didn't even expect. So there might be some, as they grow up in age, there can be, when they, particularly in teenage years, like any other teenage child, autism or children with autism also have their own problems, added to the problem that they cannot communicate effectively. So we cannot really understand what's happening. So it does get tough for some. It's a spectrum, so of course every child is different. But teenage is difficult, and with lots of hormonal changes happening, there is a possibility of aggression coming in, because then they start using their physical strength. So it is important to give them good alternatives of communication, because many a times only when they like when they're answering your questions and doing well academically, generally we feel that all is good. But it is important that we pay attention whether they are able to come out with their difficulties, whether they are able to express as much as possible. This may not be possible for everyone, but we can try and keep trying and giving them ways of communicating to us, alternate ways to um, uh, engage themselves in, apart from just academics or therapies. So that is very important, because, as you know, along with autism they are individuals. So that is very, very important that way you look at them as that. So it's not that every time they resist it is because of autism and it has to be done with this ABC thing. It's not that. I mean, even typical children do resist, and they, for them it's okay, because she doesn't want to do it, doesn't want to do it. So it is important to look at them through the eyes of both, like, okay, autism is one thing you really have to deal with, but they are individuals, respect that individuality too. So all in all, raising a child, it was just like raising. I have a daughter too who's neurotypical. So for me, it really doesn't make a difference. It is just that I mean, the same kind of discipline has to go in, the same kind of encouragement has to go in. It is just that probably what I am trying to do with both is different. Their field may be different, but it is essentially the same. So I feel it is just like the same tightrope walk that all parents have to do with children, only a little more unpredictable and difficult. But I think if you have the right kind of guidance and support, family support as well as your friends, like we at Thane, we have this foundation. Mrs. Manisha Seelam, who's another parent of a child with autism, she initiated this, and it's a whole group of parents coming together, and it's like a second family, and it's very important, because something which you feel great about, maybe some other person may not be. My son said today, for when my son started first making a voluntary sound, I was so thrilled. So only maybe another parent who has gone through that will be able to really understand what you're going through, as well as all the difficulties, without feeling a kind of pity or anything that, oh, this is so bad. Without feeling that, you'll be able to relate to each other. So it makes a huge difference when you have a company like that. So that was about my experiences up till now with my son and everybody around.
Thank you, ma'am, for sharing your information. It is commendable. You have gained a lot of information and knowledge of treatment so that you can help your own child. This is a big takeaway from today's session for every parent having special needs child, that don't just be dependent on therapists, but as a parent, you need to be knowledgeable about your own child's symptoms, and both the parents need to be on the same page. As ma'am told that, family support is very important. To be consistent with your child's upbringing is very important. So thank you so much, ma'am. And so moving ahead, Dr. Ashwini, so we saw till now the symptoms, the diagnosis part, and the age when it can be diagnosed. So are there any types of autism like Asperger's?
Yeah, okay. Yes, thank you, Dr. Mitali, for it was very wonderful, the interaction with you, and you have given it in very positive note, that how parental interaction, how understanding, how giving them an importance as an individual really helps the children and helps us too. So we are going to when we are going to see the different spectrum and the different types, as per se now we don't see the different types of autism spectrum disorder. Now they come total under one umbrella term. But Asperger syndrome is a syndrome where we usually see that these children have comparatively preserved early language milestones. They have a good language skills. Whenever you talk with them, you feel them as a little professor. They know all about the things about, if you ask them which kind of dinosaur you like, they will tell you so many lot of so things about the dinosaurs. And you will get just amused, oh so nice, this child knows so many things. But when you start communicating with the other topic other than their interest, then they may leave the topic, they may not show the interest in you, and they again can come back to the same topic of their interest. So it is kind of a thing where they have a good kind of cognition. They like to talk about some things of their own interest, but we can see that some kind of these restrictions are there in the behaviors. The another you can say the another kind of, not a kind of a type, but another kind of a feature which you can see, that some children are very high functioning. That is, if we know about 7 skills, actually they have a very good kind of motor memory. They kind of a visual memory. If you see, I have seen one picture of one artist who has done a wonderful bird eye view, kind of a sketch of whole New York City. So this is kind of the amazing abilities these children have. So this kind of the things, and which they can have. And in another subset, we can see that there are some children who can see where they kind of have a neuroregression too, where they know some things and then they lose. So there is another subset where some children, they can show you the delays along with the features of autism spectrum disorder. So again, coming to the note, I need to say is that we need to focus again at the unique strengths and challenges for each child again. Going back to you again, Prajna madam. Yeah.
Thank you, Dr. Ashwini. So as we can see that there are different types of autism, and it's very important for us to diagnose our child properly so that they can receive proper treatment. So Dr. Ashwini, I have another question to you. That is there any specific reason that an individual can have autism? Is there some vulnerability? And most importantly, what can you tell about the treatment and intervention part? You have already mentioned about it, but if you can add on to it. And
Yes.
normally, because we see it as multidisciplinary, so.
Yes. I'm going very short about this. Deciding about the reasons and vulnerability, it is again a huge topic where we can speak with so many things. The exact etiology and the primary cause is still under research. Genetic predisposition or genetic association has been found as much as in 50 to 60% of cases. We usually go to work for the reasons or the etiology when we are going for this is the first index case in our family, and we are planning, or the parents are planning for to extend the family. So in these cases, we go in search of or in depth of finding out the reasons and for the genetic evaluation. Otherwise, there is no such a specific one point reason which we can tell us about. And now the risk factors or the vulnerability. Again, most commonly, I want everyone to remember these 3 points. A sibling with autism spectrum disorder, because if one has a sibling with autism spectrum disorder, the child loses or there are deficits in his play pattern by 20%. So 20% less chances the sibling gets of interactive play. So this is one thing. Some kind of genetic predispositions like tuberous sclerosis, Fragile X, it is again a vulnerability. And there are some kind of a biological risk factors like if there is kind of a birth trauma, extreme prematurity. So all these children, they need a developmental monitoring. They need their speech, language, social communication skill monitoring. So these are the children who are at risk. Now here I want to speak about the developmental screening and the screening of autism spectrum disorder. As we know that now it has become a mandatory, or it has become proposal, or it is requested for giving as a consensus statement from the Indian Academy of Pediatrics, American Academy of Pediatrics. All the children, mind it, all the children, they should be screened for autism spectrum disorder by the age of 18 months and 24 months. That we should see that if the child lacks some major important reciprocity communication skills, like for example pointing, for example the child comes to you and shares his interest, yes, see, this is a new toy which I have liked, the child will look towards you to get the praise. So all these children, they should be screened routinely the way we give vaccination to all children. All children, they should be screened by 18 to 24 months about the risk factors of autism spectrum disorder, and where we can work them early. Now going in short about the treatment plan, we know that early intervention, early diagnosis, early means what? The time when you feel the concern. Okay, that early, because many parents feel it by the end of 1 year, by the end of 1.5 years, by 18 months, many parents feel that something is going different. As Dr. Mitali told, that she felt that everything was going wrong, normal, and they felt that there is something different in the behavior of the child. So that time we start intervention. It is not the time when we diagnose, it is the time when we feel that there is a concern. So this is the thing when we start as early as by 1 to 2 years too. Now, again, the second important thing which needs to be remembered in the treatment plan, it is each child has an individualized developmental plan. We try to see the facets in all the times of development: gross motor, fine motor, self-help skills, social communication, language skills, and we develop a kind of a plan set for the child. As Dr. Mitali mentioned, it is regarding the organization, regarding the involvement of the child. There are basically, I can divide it in 3 roughly steps. In the first step, or the early years, we work more towards of a communication, involvement, giving an eye contact, joint attention, sitting tolerance, learning, imitation. Every child, our main aim is that the child should be independent in self-help skills: eating, brushing, bathing, toilet training, treating the child's sensory issues. If the child is just roaming around, the child should sit, because how the child learns giving attention to you. What you're doing, the child should look at you. The child should imitate you. So these are the main points. Treating their eating difficulties, because many of these children, they have picky eater, they do have constipation. So managing these medical issues. And one important facet which we should see, that many children, they do have behavioral issues. Many children, because of ineffectiveness in communication, not able to make the other person understand what exactly they want, many can have tantrums. They may scratch you, they may bite you, they may throw objects. So making child understanding the child's clue, and whenever necessary, the role of medication comes. Here again, there are 3 different patterns in this triangle. One thing is understanding the child, individualized, starting therapy. Again, the therapy plan is again individualized. Some children, they require occupational therapy first. Some children can skip occupational therapy, they can go to special education. Some children, they require both hand in hand. Some children require more focus on their sensory aspects. Some children, they require more focus directly on speech language skills. So this is the therapy part. Then according to the therapy, and as Dr. Mitali mentioned, involvement with the child, developing a relationship with the child is at the home plan. Understanding my own child, I am there throughout 24 hours with my child. The child is going to learn with me throughout all small interactions, like making a poli, making him feed, eating, brushing, bathing. So taking all those small opportunities where I can see, I can help my child. This is the home plan. We guide about the parents regarding this home plan. Because for many parents, if the child eats properly, the child sleeps properly, they feel so good. They feel, yes, I'm gaining something. They get that confidence, and then they can think of the next step. And the third part is the medication. Now here I'm going to take just 2 minutes about the medications. Is that we think that the medications don't cure the autism spectrum disorder. And then what is the role of medication? Here, the medications don't directly work on the hardcore features, but the medications do help and do prepare the child ready for accepting the therapy, because again, this medication plan differs in each child. For some children who have difficult behaviors, who have lot of inattention, who have lot of hyperactivity, where even we are starting with the therapy, we are not getting the thing which we want. It is very difficult for being the parents to understand, to help the child, to organize the child. So here at this point, we need to focus which kind of behavior we are treating with the medication. If we decide that, we can definitely help in these children to increase their attention, to increase their sitting tolerance, to decrease the hyperactivity, because the medications do help regarding the subset of comorbidity, where I can think Dr. Girija also can help us better with what kind of comorbidities we do face. The comorbidities do change in the school years, where inattentive kind of ADHD, where specific learning issues, specific in some children, the social fear can go into social anxiety. These children, they may not communicate. They want to communicate, like just in school years, like in adulthood. They want to mix with you, but they don't know how to. They can go into isolation. They can go into depression. So all these kind of comorbidities, they can be effectively managed with medication and help to child participate. So this is the first step. The second step is making the child ready to sit in a group. Initially in the first years, it is 1:1. The child and the therapist, the child and the parents, the child and the teacher, the child and the daycare facets. So now we are making the ready for the child to sit in a group of 5-6 people, then 10-15 children, and to make the child ready to sit in a group and learn. This is the second step. The child should be ready to go to a school and learn in the school, and then managing their scholastic issues. And then the third is when the child goes into an age group where we need a vocational or a formal training. Again, I think Dr. Girija is going to help us over there, how we can go ahead to that step and make them help out in this training. So these are roughly the 3 steps of treatment plan. And here again, I want to imbibe the multidisciplinary approach, because the multidisciplines that we may need, the different specialists from the different domains, the occupational therapist, the special education therapist, then the speech language pathologist, the psychiatrist, the neurologist, a developmental pediatrician who is at the maybe at the pivotal point, who is going through all these managing all these facets. And so these are maybe audiologists. So all these are the different specialists who are going to work together hand in hand with parents to help the child. And here I just want to take 1 minute about the effect of corona era on these children, because there are so many parents who may be listening to us, who may go through it, maybe caretakers. They may feel that, oh, there are so many things in my child. Does my child has autism? Because many children, because of not getting the typical developmental environment or the social environment, many children, we do feel that now they are imbibed in self. They're not coming out of home. They want to stay in their comfort zone. They are getting communication issues. These children, because of excess screen, doesn't want to go mix with you. So many of these children currently, they are showing the social communication deficits. Here, with the help of the expert person, we can see, are they really fulfilling all the criteria? So don't get stressed out with all these things. And as much as possible, give your child a typical developing environment where you can interact, you can play with your child. You don't need so many different toys. You don't need a shape sorter. You don't need a different kind of specific toys which the therapist have. It's all everything between you and your child, and the surrounding environment which you have in your home. So as this is as simple as that. So I think I am much about clear about the treatment plan. And with this, we again go back to the next question answer series. Thank you.
Thank you, ma'am. You have shared so much of information with us, which is actually, to the point and very, it is, I'm sure it is going to help all the parents who are watching this program. So what I have, what I feel is that what you have, just to summarize your thing, that very important is the screener, the assessment to diagnose your child for the proper treatment plan. And taking medicines is also important. Yes, because there are a few parents who are hesitant. They feel that, oh, it is going to be dependent. My child is going to be dependent on medicines. So it's also very important to regularly be in touch with your doctor and take medicines as per prescribed by your doctor. And also there are various therapies, as ma'am has mentioned. It is occupational therapy, speech therapy, as per your child's needs. Watch out for the symptoms and work towards it. Isn't it, Ashwini ma'am? Yeah. Am I right?
Yes,
All
you're
right.
right.
Okay. So moving ahead, Dr. Mitali, how will you describe your experience with the treatment part? Are there any specific resources that you would like to share with our viewers?
Yeah. As I mentioned earlier, we definitely started with ABA and occupational therapy and speech therapy. So they helped in, once to start building the skills, the basic skills required for learning. But what I feel was also essential, more apart from them, is a program which helps you motivate your child. Because if you see that, particularly in autism, this motivation is lacking. In many other disabilities, you will find that although they have difficulty in doing things, the basic motivation to get better, to challenge themselves, to seek help, and to make their, like the next day to be better than the day before, is inherent and instinctive. But this particular thing is not seen so much. Not all, of course, autism is a spectrum, but very commonly you will. That's why the restricted interests are there, because they are able to manage themselves better. The rigidity, the time schedules, rigidity to place and person, is because they want to keep their in the world as same similar, to be able to manage better. So this basic foundation of accepting challenge in anything that comes up, they do accept challenges in their own area of interest, but to accept challenges and to take help of a guide to reach those challenges is an essential foundation that children build in themselves as young as around, say, by 1 year. But this does not happen very well in children with autism, and most of the programs are focused on building the skills, but sometimes they are not enough to build the motivation of learning. So here is somewhere where for me, RDI really worked to develop that motivation for the child to look around, to look up and take and not just wait for instructions, but to see for himself what is expected and to think through. So these are what we call as a dynamic skills. So static skills are all the skills that we learn: the sorting, matching, counting, reading, writing, and all the academics. So this is definitely the static skills, but to put those static skills in place and available for use in any situation outside, what you need is a dynamic skills to learn from your experiences, join attention, so to learn from a guide or anyone who's more experienced than you. This really helps, and that is an essential part when you're considering treatment, whether the treatment is addressing the readiness of your child. Because sometimes we, just because he's of this age, we keep on giving something that we expect them to do, which they may not be ready, and which increases the anxiety. So it is important to see where your child is ready at, and that is very important to be able to read the feedback. So resistance is just their way of saying that this is difficult. Now, where it is difficult, it is anybody's guess, because sometimes we may not be able to know the exact place where it is difficult, but we have to at least understand that this is difficult. So let us slow down, let us simplify, let us give some extra support. So I think that fine tuning is necessary with your child along with what your therapist is and doctors are advising you. So they are there to guide you how to help your child, as well as your understanding of his or her feedback. So RTI really helped us with the dynamic skills, and along with that, there have been I have definitely tried MNRI, which deals with the reflexes, the motor reflexes, which are will gradually develop during infanthood and all. They all have helped. I've tried Handle, which is similar to occupational therapy. They definitely have helped, but what has really helped is what you do every day, continuously throughout your life. So the special education, which increases their vocabulary and static skills and motor skills, that is important. And along with that, a program which helps them to develop their dynamic skills of problem solving and monitoring the environment. So these are important. So if both of them are in place, it really helps. Communication is very important. So if your child is not able to speak, you have different. So of course, speech therapy is going on, but yet some children do not develop speech. But it is very important for them to have an alternative way of communication. So I personally use assisted communication. I use the Avaz app, and it really opened my eyes to so many things that my son knew, but only because he couldn't speak. I never thought he knew. So it opened a whole new world for us, which we are very eagerly exploring now. So communication, you need beyond just answering questions and obeying instructions. It is important on what is this and what is that and all that. It is important that they have some way of communicating to you. So that is very, very important. The last part, that as Dr. Ashwini ma'am mentioned about medicines, yes, and in some medicines should not be given just to make things easier. Just because okay, just I'll give some medicine and it will get over. There is no magic pill. But if the medicines are required to just calm the mind, if you have done everything, you have tried everything, all therapies and all ways of behavior modification, but it's difficult to reach the child because of the inherent hyperactivity or anxiety, then definitely medicines do have a role, and when given in the right with the right advice of the doctors, they can be of help. So all of these together really helps the child and the family in so that has been my experience.
Okay. So, Dr. Mitali, what I understand is that it's very important to show interest in the child's interest,
Yeah.
isn't it? And acceptance is very important. There
So,
are,
yeah, so I mean, just don't apply the norms. See, at this age, you should be doing this. Okay, that is a guideline. That's okay. But it is important that all the foundations are cleared first before you go for any higher.
right.
That is important.
Okay. So, is it possible to integrate our children, adolescents, and young adults with autism in our school, colleges, and our workplace?
Yeah, that's a very good question, and I think that's the first question that or rather the question which keeps circling in the minds of parents and caregivers and teachers. As in, what exactly, how, whether this integration can happen. So, at the as a in a general term, I would say yes. I mean, see, it's a spectrum, and those with say slightly or rather I would say that who have better communication, better self-regulation, and ability to be a part of a group, yes, they can be integrated with rather much more ease than the others. But for me, I would rather introspect as in what is integration exactly. What is integration to me? So as far as I'm concerned, I feel that only if you're going to a normal school or regular school, I would call, only if you're going to or your child is going to a regular school, or an individual is going to a open employment or a job place, only those are integrated. I do not think so. That is just one type of integration. What is important is that your child is learning, that your child is happy, that your child is comfortable, the child is exploring different things like music and dance and some play therapy and all. He's comfortable, or he or she is comfortable and at ease with what is happening, and every day is learning. if they are getting up with a purpose on their mind in the day, that I have to go here, I have to do this and come back, and if they are able to take care of themselves as much as possible for each individual, if they have interests which give them happiness, if they're able to pursue a hobby, then it doesn't matter if they are going to a special school, if they are going to a regular school, or they are going to a sheltered workshop, or they are going to an open employment. They are a part of society, they are doing their bit, they are a functional part of the society. They are just going to a place which is suited to their requirements of support and challenge. So as long as this is happening, they have a purpose in life, they're enjoying what they do, that is integration for me. They are not isolated. When during times of leisure, or they can go to they can go to movies and restaurants and or parks just like everyone else. So if that is happening, then I would call it integration, even if it is not a regular school or that. Because yeah, many parents, the first thing that they, once their child is diagnosed, that will he be able to will he be normal again? That sometimes they ask. So our perceptions change. It is important, like every other child, they keep learning, they are happy, they are appreciated, because definitely challenges are going to be there. But if you understand, one more thing I would really stress on is, all of the disabilities, we give that respect. We know, we see a person in wheelchair, we know that they will have some challenges, and we tend to go along and make those adaptations. And a visually handicapped person, a hearing impaired, but somewhere when it comes to intellectual impairment, it is not looked at, in that same way. It is like, nahi, this, they're not able to do some certain things. So but they have those challenges, they have a problem. Whatever we say, that is there. So we need to give that due respect, that every day that they are doing things which you want them to do, they are overcoming obstacles. So look at them with that appreciation. That is, I mean, my son is my hero, because I see him trying to do things, I mean, trying to adapt to this world, which I know, rather than the world adapting to him, it is him who is doing so, trying every day a little bit. So it is important that we meet them halfway. So even if they are going to a special school or sheltered, and I have seen there so many lovely organizations in Mumbai also. In Thane, we are doing at a vocational center, and they have set up their own businesses which they are doing on their own or as a group. So, and it's important, you can see the smile. I mean, there's a video which I'll be sharing of our center, and what's important is the smile on the children's faces, the pride on the parents' faces, and that mutual support which is there, that yes, my life means something. So that is the agency is very important. This is me who is doing it. So once that is in place, wherever you are, it is integration, is what I believe. So that is something you really have to do.
It's very important to be compassionate when around the families of autistic children, isn't it, ma'am? So,
Rather, yeah, compassionate, yes. Rather, I would feel, I don't know whether the right word would be compassion,
or
but
empathy.
yeah, empathy would be a better word, because, as I said, it is important that you know that some, like for example, there are challenges or there are behavioral problems which is there when you go in the society. Sometimes your child has a lot of sensory overwhelming problem, and things which appear, I mean, simple thing like marriage functions, and there's a lot of noise and a lot of loud noise, or birthday parties, somebody may be afraid of a balloon, which is, you don't know why, but it's there. And it is just that there's a huge meltdown. So and the family doesn't know what to do, you just have to manage over there. So it is important that you be encouraging to them, like it's okay, fine, that's fine, it's, you can handle. I mean, some do not completely sometimes people don't know what to do, then they just do not pay any attention. So I, be as natural as any other child who's having a problem, who's having some sort of an upset day. It can happen. Only thing with autism, it is difficult to regulate emotions. So, and eventually it will happen, but maybe at that time, at that day, it is just gone overboard. So so important thing is, when in a social situation, yes, be encouraging, offer any help that you can do. Maybe you can, if they are busy with a child, if there is a sibling, you can take care of them at that point of time, or you can take the child's autism and maybe do something which is interested to him. because parents feel very good when they see that all the relatives are coming and interacting with your child. Let it be even a high five or something, but it is important that you take note. Sometimes what happens, people are scared. I don't know what to do. Better not to do anything. But then there is a feeling that you're not even noticing my child was here. So because they don't have the intentions are good. They don't want to do something wrong. But go and talk. Maybe the child may not respond as the way you want, but a high five or something like that, it goes a lot in helping the family integrate, because autism affects the entire family. So if that is one way of integrating the entire the child as well as the family, and it goes a lot. And also caregiving for a child with autism comes with its challenges. um, there's a lot of emotional overload for the parents also. There is no denying that, because it is a difficult situation sometimes. You do not know what you're trying, everything your therapist has told you, your doctor has told you. It looks very good on when they say it, but when you're doing it at home, sometimes it doesn't work. So it is important at that time that you, even for the parents, say, okay, I've tried my best, it's fine, sometimes things don't work out. As well as it is important that they can get a time off from just caregiving for them, because it's important that parents also give importance to their life as a couple. Sometimes it's not only about children, it should not be rather only about children, because after some time other children, they'll go about their own lives. But children with autism, it's all the caregiving always goes on. Rather, it is also good if you give them that time, that space. It is good for them too, as well as it's good for the parents also. So I think family support and friends and family can chip in to make sure that they have some time for themselves, and that they are felt as a part of the entire society along with their children with autism. So if that happens, then and as the children go older, as they say, like they have certain skills, they may have certain problems, but whatever can be done, give them opportunities to show the skills that they have. So it could be in arts, or it could be in vocational, vocational setups. So if you're able to give them that opportunity, they'll definitely show what all they can do, and that makes the parents also very happy, and the child really feels or the adult and the youngsters, they feel very purposeful, because it's the same individual, just like all other individuals. They also want the appreciation, they also want to be noticed for what they are doing. It's just that certain ways may be different. That's the only thing. So that is what you call as neurodiversity. That's the only. But the basics are always
It's very important to focus on the child's strengths,
yes.
right? So I hope we have sensitized our audience, and I'm sure that when we see them around us, we'll treat them normally and with empathy and compassion. So, ma'am, can you give us any take-home message for our viewers?
This is one more thing I had to add was, when we consider integration, it is we always also have to think that there is the work has been in two ways. One is the place where they are going to be, that has to be sensitized for their challenges and problems, and also their skills which are there. As well as not only that, we also need to prepare our students, our individuals with autism, for the dynamic stuff, because many a time this is left behind. They're given a set of, they are equipped with a set of skills. For example, they can type and they can say do data entry work, but these are static skills. Beyond that, there's a lot of adjustment to be done with the co-workers. There's a lot of changes, because that, as we say, the world is messy, it's changing. Today something is there, tomorrow something else might happen. So it is important to, right from childhood, to train your child, to try and work on a program which helps your child develop this dynamic skills for further, not to be so to self-regulate, that is to control his own behaviors, and to co-regulate, like is to adjust his behaviors according to the changing situations. A take-home message I would be, yes, that believe in your child, and keep trying, keep exploring treatment by the pathways, whatever will help your child. But make sure that your child is comfortable, motivated, participant in what is happening, and never, I mean, always things will get better. Definitely challenges will occur, But and there will be some days where you will feel that I tried everything but it's not working. It's okay, just leave it at that for some moment and take it up again. It is important to take care of yourself emotionally too. And for parents, I would say that don't forget to focus on yourself too. For the society, I would say that keep encouraging, keep integrating, keep assimilating everyone into whatever you're doing. And do not, try to know more about autism, interact with them, and maybe not at the first time, and the third, fourth time, you'll be able to get that interaction happening. And I'm sure that all our children and adults with autism have a lot to give the society. So they should be given that opportunity. That would be it.
Thank you, Dr. Mitali. Would you like to give us some take-home message for our viewers?
Hello.
Yes, doctor.
Yeah, okay. Yeah. I was not able to hear. Yes, definitely. I think the session itself gives the take-home message. And as Dr. Mitali said, starting from an early age, helping them throughout the developing years of life, the help which they need in the school years, and then into adulthood, integrating them throughout all the stages of life will be our aim, and every one of us should help them and should help the society too in doing the same thing.
Definitely.
So the take home message would be start early and you will do well. That's it. Thank you very much.
Thank you, ma'am, so much. So what an engaging session it was, wasn't it? Before we come to an end of session, we're extremely happy to announce that Symbiosis Center for Emotional Wellbeing has just launched a one of its kind degree program, BSc Mental Health. So I now invite Dr. Girija Mahale, consultant psychiatrist and head of SKU, to brief us about this program. And also, if you can just ponder upon what session we just had on autism.
Surely. Thank you, Pradnya. First of all, a big
Uh,
hello.
yes.
Am I audible?
Yeah.
Yes, ma'am.
Oh, okay. Yeah. So a big thank you to Mitali and Ashwini, Dr. Ashwini, for making their time here. And I think the information shared by Mitali especially was so unique. I think, yes, from a developmental pediatrician, Dr. Ashwini provided the right factual and knowledgeable information. That is a must. But along with that, I think Mitali provided something which was extremely unique, which not many people are aware of. I think when she spoke about, I think what I understood today, and there was a lot to learn for me as well from this session, is that, when I completely, I'm going to refrain myself from calling it a disorder anymore, because children with autism are just different to the children that we normally see. The spectrum that we see as normal, what we call as normal, is we who have defined it as normal. Who are we to call them as a disorder or abnormal? They are just children with different abilities, different strengths, and just that we are not able. I think it is a problem on our end that we are not able to understand them, and which is what creates the difficulties and challenges. But if we take the time out and show the perseverance and patience to understand our child, then I think it is no longer a disorder and something to be scared of. So, what I learned from it is really push away your apprehensions and fears. Yes, take the child early to a pediatrician so that you're able to understand your child early on and accept that this is something which is a different child to what I see in the population, but that it does not mean that there is a problem. It is just that I need to understand my child and provide him the necessary inputs so that the child is able to flourish, be happy at the end of the day. That is our aim, to make enable the child to be independent, autonomous, and be happy at the end of the day along with the family. And I completely agree that integration is not just about putting him in a regular school, but about allowing the child to be comfortable, to be treated with respect and dignity, and to be allowing the child to, flourish with the unique strengths and abilities that they come with. So wonderful session. Once again, I'm truly, truly thankful, Mithali and Dr. Ashwini. And also to let my viewers know that Mithali is one of my best friends. We were in school together, and you won't believe I used to stick with Mithali all through
Yeah.
because she's a wonderful individual. I mean, forget she is intelligent, that's one aspect, but apart from that, as a human being, I've known her for so many years, right through childhood, and she's an excellent human being, very humble, very modest, and very down to earth. And I think these unique qualities in Mitali make her a wonderful parent as well. And I'm so proud of her and proud to have a friend like her. And equally thankful to Dr. Ashwini, who has never said no to any of our requests. And she herself has a very young child right now at home. But despite all of that, she has always been a very keen and enthusiastic participant in all our workshops. And for whatever work, I also call her outside of these workshops. She has always been very keen and encouraging. So thank you to both of you all. And yes, we are launching a very new academic program, first of its kind, BSc in mental health. And that has come from our experience working as mental health professionals, where we realize that there is definitely a dearth of mental health professionals today in our community, given the ever increasing prevalence of mental health problems in our society. It is time that we look at mental health from a very multidisciplinary lens. It is time that we look at mental health through a very holistic view and not just from a medical perspective. It's very important that mental health is determined by social determinants and cultural determinants play a very important role when it comes to mental health. So this program aims to kind of bring all of that together using a very multidisciplinary lens, training our mental health professionals to be very holistic, individualistic in their approach, in the sense that very client centric and collaborative care is what we are really encouraging through our program. So it comes, it's a very skill based program. It has 2 internships ingrained within the academic program itself. So it is a very, I would not, it is, we have identified the gaps that are currently there in terms of the psychology courses, as well as looking at my own experience learning psychiatry. We realize that there needs to be a very comprehensive program which can enable individuals to treat individuals with mental health problems, again, with respect, dignity, compassion, empathy, and empower them to lead a life which is respectful, which is meaningful and purposeful. And that's what our degree graduates will be able to do with individuals with mental health issues. So I encourage students who are in 12th to look at our program, to have interactions with us. We will be coming up with webinars which will talk more about our program. And I request all the 12th standard students to be a part of that webinar, at least to hear us out and see what we have to offer, and then make an informed decision about your career choices. So thank you so much, Pradnya, for organizing such a wonderful session and for asking very relevant questions to our speakers today, our eminent panelists. And just to our audience, let our audience know that this session will recording of this will be available on our YouTube channel. So do spread the word, because I think it's important that we as community, spread the word about what autism is and create that awareness so that individuals who are dealing with autism do get that opportunity to lead their lives with respect and dignity. Thank you so much once again.
Thank you, ma'am. Thank you. This
Many
wonderful session comes to an end here. What an enlightening session this has been. We sincerely hope and wish that the thoughts, knowledge, and information shared by our esteemed panelists will help parents in the process of early identification and treatment, and also help all of us to understand autism spectrum disorder better. We sincerely thank Dr. Ashwini and Dr. Mitali for sparing time for us in spite of their busy schedules and enlightening and sensitizing us about autism. We would also like to thank Dr. Kirija Mahale, she's the head of SKU, and Ms. Sangeeta Rishi Pathak, psychological counselor at SKU, and the entire SKU team for organizing this wonderful session for us. Our heartfelt gratitude towards Dr. Gargi Mitra. She is the head of Symbiosis Schools of Central Directorate. I cannot thank enough our director Oja sir, vice principal Madan sir, and SEN head Deepa ma'am from Symbiosis International School for their constant cooperation and support. This session would not have been possible without our IT team. So thank you, Praveen sir and his team. And last but not the least, thank you all our viewers for joining this session. We would like to end this session by sharing this beautiful video where we can actually see these amazing children in action. Can we please have the video, Praveen sir?
Can I just say something?
Sure, ma'am.
So I think SKU is an amazing project, and I mean the entire focus on emotional well-being. This is where they do the data entry, professional job. We have actually gone to the Amazon warehouse,
Okay.
a distributing center, and they did the internship there. 4 of them have got selected for this job also.
Wow.
देंगे वही सलामियाँ दिल थाम के जहाँ देखेगा एक दिन तेरी भी कामयाबियाँ करके दिखा कमाल वो आके ज़मीं पे दे के जाए आसमां शाबाशियाँ 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 शाबाशियाँ
So there are different nutritional things that keep happening. And in fact, once they like to work, they'll keep on working. So it's just amazing to see them. You have to actually take things away from them.
सच होने की खातिर जो सपने कीमत मांगेंगे जाग के रातें कीमत भर देना जब नजदीक से देखें तो खुशियों के आंसू आए तू नजरों को वो मंजर देना खूबी एक ही एक दिन मिटाएगी तेरी हजार खामियां करके दिखा कमाल वो आके ज़मीं पे दे के जाए आसमां शाबाशियाँ शाबाशियाँ
We have a program in
शाबाशियाँ
it's like entire 3 hours program.
Shabashi
Who's our current center?
In the video, it looks so easy and flawless, but I'm sure a lot of hard work has gone, into it. Commendable work, ma'am. Amazing, really amazing. Thank you so much once again, Mitali, ma'am,
Thanks
and
a
Dr.
lot for
Ashwini, ma'am.
having the opportunity to reach out through this webinar, and it was really great. Thank you so much, Girija, for giving me this. It's always so nice to associate with her. I don't know, it's seeing us in neighboring windows also, reminds me of my childhood.
Oh yes, all those memories.
And I think that's what I was saying before we started the video, that focusing on emotional well-being is definitely the need of the hour, be it any field. I see it's also important for moms and our moms and dads. I mean, both of them. It is really important that people give importance to emotional well-being. We see so many, read so many things around, and we see, oh, this could be prevented so much if they're able to help with the emotional well-being. So I really wish this project all the best, and may it
Thank
reach to
you.
all those who really need it.
Thank you so much, Mitali. Thanks a lot.
Thank you so much, everyone.
Thank you, Pratnya, you conducted it so well, and the questions were really helpful, for us to construct what we wanted to say. Because autism is such a huge thing; it is very difficult, as what to say. So, entire team very nicely